to it in just a moment, though. Let's go on now. It is the #1 infectious killer of newborns in the United States. About 30% of women carry the bacteria that causes it, but they may never know it.
It is Group B Strep, and while it isn't dangerous to adults, it is potentially deadly to babies. I know because my daughter Nicole was born with it. Tonight I begin a 2-part series on Group B Strep. I'm sharing my story to spread the word about Group B Strep and tell you what every mother should know.
Here comes Mama walking down the hallway for the last time.
On the morning of May 30th, the 9-month wait was over. It was time to head to the hospital to have what I expected to be a healthy little girl.
I can't believe it. Oh, baby, that's my baby growing.
Almost 15 hours later, Nicole Danielle arrived. Her APGAR score, a health rating for newborns, was high. She looked and sounded healthy. She was a perfect little dream come true.
You're such a good little girl. Yes, you are.
But a few hours later, that dream turned into a nightmare. I went from holding a healthy little girl to watching a very sick baby struggle to breathe. This was Nicole's first day of life. Her head under an oxygen hood, wires attached to her body, an IV stuck in her hand, and her heels red and swollen from needle pricks. My daughter was a victim of Group B Strep.
It happened in a matter of seconds. The nurses can look at a baby and be well, and then a matter of minutes later look back and the baby's ashen and pale and in shock and critically ill.
Push again, you still have contractions. Count.
Group B Strep is passed through the mother to the infant during delivery.
Yeah, I know. Hey.
About 8,000 babies are born with it every year. 800 of those may die, and some who survive will be left permanently handicapped.
It can cause the baby to be extremely ill. The baby can have shock or severe respiratory distress or meningitis, a very life-threatening situation.
7 years ago, my family learned what it's like to be a statistic.
Charmin Hill knows all about Group B Strep. Her story started like mine, but the ending was very different.
She died just shy of 24 hours.
Charmin's baby girl Alyssa died of Group B Strep in 1991. Although there is a test to detect Group B Strep in women, not all doctors offer it. Like me, Charmin was not tested. She now gives speeches on the subject and hopes all women will learn a life-saving message.
It is a message that I will tell everybody. At least get the test. Just the knowledge of, are you a Group B Strep positive mom or not, can make a big difference. Put your hand on. Okay.
Today, Charmin has a healthy 3-year-old boy, Jay. Charmin was tested and treated with antibiotics during labor, and Jay didn't contract Group B Strep. As for Nicole, she's the picture of health. And while we're thankful she survived with no lasting effects, we will never forget these pictures of her struggle against Group B Strep.
As Charmin mentioned, there is a simple test to detect Group B Strep and a way to treat it. But not all doctors test their patients. Tomorrow night, we will tell you why.
Fascinating series, very interesting. Now, and it's so good to see Nicole. It's so healthy.
Oh, yes.
And well,
very thankful for that.
I know. But how about women who have had healthy babies in the past? Do they have anything to worry about for future pregnancies?
That's the thing about Group B Strep. It can come and go. So if you have 4 kids at home and you get pregnant, you still need to be tested, because even if you've never been tested in the past and you have healthy kids, it can still happen on your 4th pregnancy, your 2nd pregnancy. I would recommend get tested, and we'll look at that issue tomorrow night.
All right. Sounds good. Thank you. Nicely done.
It was cool today.
Sure
nice.
was. Nice and cool. Kind of pleasant outside. Meteorologist Reg Taylor is up next with the exclusive AccuWeather forecast. Group B Strep. It's a bacterial infection, and it affects more newborns than Down syndrome, neural tube defects, and PKU combined.
And while pregnant women are screened for those problems, there is no mandate to screen women for Group B Strep. Tonight, we look at the guidelines for detecting Group B Strep in pregnant women and why even doctors disagree on the best way to prevent babies from getting it. It is what every mother should know.
This is the most important thing that we do to prevent infections in the nursery.
For Dr. Tom Austin, babies are his business. He's the founder of the Neonatal Intensive Care Unit at Palmetto Richland Memorial, and he has seen what Group B Strep can do to babies.
Babies can get extremely critically ill and very rapidly. The majority of cases that attack the newborn occur in the first few hours of life. And that's why we have to go to some strategy that prevents the disease in the newborn. If we wait till it occurs in the newborn, oftentimes it's too late to treat. Is the baby's vital signs okay?
Antibiotics given during labor will, in most cases, prevent the baby from getting Group B Strep. The problem is deciding which women to treat. There are two recommended strategies. Test every woman for Group B strep late in pregnancy and treat those who test positive, or monitor for high risk factors during labor and treat only those with risk factors. Risk factors like premature labor, fever, or multiple births.
Hi, how are you doing today?
Dr. Janice Bacon is an OBGYN who does not routinely test patients for Group B strep.
Any patient of mine who requests testing, I'm happy to treat. I'm happy to treat. But I'm also a scientist, and I can't just test everybody for everything that's potential. You know, I could do a lot of blood work that's really not necessary, but I would uncover only a small amount of benefit.
Not all OBGYNs agree on the proper way to prevent Group B strep in babies. I did my own survey and called 16 area practices. 14 of the 16 test every woman at 36 weeks of pregnancy. One of those practices is located in this building, Palmetto OBGYN.
Personally, from the standpoint of having an infant die of beta strep sepsis, that in itself, if you lose one infant, that's one too many. Hey, Greta, you have those alpha-fetoprotein results that we were getting the other day?
Dr. David Holliday decided years ago to test every patient.
As more people become more informed about it and know about it, they want to be tested. So it's much easier for us to test than to treat on risk symptoms. And also, we feel better about it.
And come on, lots of power.
I did not have high-risk symptoms during labor, but my daughter Nicole was born with Group B strep.
This is a miracle baby.
Dr. Ralston cared for Nicole those first fragile days. He admits that had I been tested and treated during labor, Nicole's beginning could have been much different.
About 10% of all babies that moms are treated will get it, but the high probability is that if you had had penicillin prior to delivery, Nicole probably wouldn't have had Group B strep.
While there is no strategy that catches every case of Group B strep, studies show that testing late in pregnancy and treating during labor prevents 86% of cases in newborns. Monitoring for high risk factors prevents only about 68% of cases. If you are pregnant, talk with your doctor, find out their strategy, and make sure you're comfortable with it.
Fascinating series, and so good to see Nicole is doing so well now.
Yes.
Yeah. Now, if your doctor doesn't test and you want a test, what do you do?
As Dr. Bacon said, if you ask for the test, they're going to give it to you. They're required by law if you want the test to get it. All it is a swab, and it costs about $35. The main thing is talk to your doctor, be aware of it. I want women to take a proactive role in this and not be surprised like I was.
All right, this is great to know.
Yes, it's important to know.
I'd say so.
It cleared up a little bit this afternoon.
Yeah, it did, for a while.
For a while.
And then the clouds came back. Reg Taylor's up next with your exclusive AccuWeather forecast.
Tomorrow.